Thank you, Senator. Doctor, thanks for being here. Congratulations on your nomination. Before I start, I'd like to say a little something about your nomination. It's really nothing against you. I'd like to take the opportunity to draw a comparison between this nomination and other nominations pending in the Senate. Ones that I'm holding from passing by unanimous consent. Your predecessor, Dr. Collins, was approved by unanimous consent in 2009, only 4 weeks after being nominated. The Health Committee did not even hold a regular hearing like this. You have faced a much different confirmation process. Your nomination was held up by Chairman Sanders, which is his prerogative. We have had no confirmed NIH director for 21 months. Back in June, Chairman Sanders publicly vowed to oppose your nomination until he received the administration's comprehensive plan on lowering drug prices, which we all know that's what he's about, and a lot of us are about. As I recall, he promised to hold up not only your nomination, but all health-related nominations going through the Health Committee. As a senator, he has a right to do that. He wanted a policy concession from the Biden administration, and apparently he got one. I was one of the many who want us to have a confirmed NIH director. A lot of people have wanted us to have a confirmed director. It's not unusual, but I don't remember any Democrats saying the sky was falling because we didn't have a confirmed NIH director, because this is a very important position. I don't remember Democrats calling the chairman names or even threatening. I don't remember anybody wanting to change the rules of the Senate because of it. I didn't really say a word about it. If it weren't for hypocrisy around this place, I don't think we could have anything to do. Chairman Sanders got what he wanted. On September 8th, Chairman Sanders announced that the White House met his demands, and he announced this hearing. Chairman Sanders used his prerogative as a senator. I don't have all the details of the concessions the Biden administration made to Chairman Sanders, but I respect his rights as a senator. Frankly, I appreciate Chairman Sanders' defense of the legislative branch. We ought to legislate around here. That's what we were sent here to do. We weren't elected to just outsource our jobs to Joe Biden or any other president. The chairman and I don't agree on everything, but at least he is standing up for what he believes in and the power of the Senate. So I'll get off my horse now and ask you a question. This very, being an educator, this really touches me here. The NIH funded a recent study about the psychosocial functioning in transgender youth after 2 years of hormones. According to the letter NIH sent to Ranking Member Cassidy and me, the research seeks to understand the physical and psychosocial effects of medical intervention to evaluate the effectiveness of existing medical treatments already in use among transgender youth. As you know, 2 young people committed suicide who were part of this study. That's obviously a tragedy. But what concerns me even more is the fact that the NIH was funding this research. And beyond that, I believe the NIH even called the study a success. That's sick. It sounds to me like the NIH totally dropped the ball on quality control and oversight. So, if confirmed, how will you make sure nothing like that ever happens on your watch?
So first, Senator, I really thank you for your affirmation of the critical importance of NIH and what we are, and that we are here to serve the American people, and just how critical that is and how important this job is. And to that end, in response to your question, we have the greatest responsibility to ensure 2 things. First, that we serve all people, all walks of life, and that we really are here to achieve the health of all. But that number 2, any research that we do that involves human beings, people, is conducted according to the highest ethical principles, so that we make sure that the research is intending to do no harm, to achieve benefit, and is done in ways that have maximum respect for the dignity of people. If confirmed as NIH director, I will affirm to you that that will be my mode of action and my highest priority for all human research.
Thank you. One more quick question, Chairman. The NIH used to be universally respected non-political organization before COVID, but that trust has been broken, especially in rural parts like my state of Alabama. You're from a rural Wyoming, so you get the rural perspective and you understand just how much people in those parts of the country in particular have lost confidence in our public health institutions. They feel totally overlooked. You know, what would you do as NIH director to help gain back some of that respect in rural areas?
Thank you so much for that question, and I'll be very, very brief. Two things. Number one, I believe deeply in the doctor-patient relationship. That is incredible value. That is trust. A patient comes and puts their life in the hands and their health in the hands of their doctors. And anything that we can do to strengthen the doctor-patient relationship is something that we should pursue to the fullest extent possible. And then second, I believe in education at all levels, being very, and relating, our patients joining us in research to the fullest extent possible. Not science here and people here, but people joining us to do science. I think that also engenders great trust in the process if it's done in a respectful and appropriate way.
Thank you. Senator